My name is Dr. Kurt Belk, and I'm a board-certified emergency physician and the medical director of the Urgency Room. I want to thank you for choosing us as your healthcare provider. The following video offers follow-up care instructions to your recent visit.
Hello, I'm Dr. Gary Gozwish, a board-certified emergency physician. You received urgent medical attention today because you have an open wound. Open wounds can range from superficial abrasions and burns to cuts or even deep lacerations. Wounds can affect nerves, muscle, bone, and connective tissue. Your doctor needed to examine your wound and clean it to find out the extent of the injury. We needed to know when it happened, how it happened, and what symptoms you exhibited. The decision for your treatment was based on the severity and location of your wound. Your wound may have a dressing that can be as simple as a Band-Aid or tissue adhesive, which is often called medical superglue, or you may have a more complex dressing. You may be wearing an immobilizing splint to hold the wound still and aid the healing process. Or you may have sutures, also called stitches. In general, sutures stay in an average of 5 to 14 days based on the location and complexity of your sutures. In areas that are of high blood flow, such as the face, sutures will stay in an average of 3 to 5 days to avoid scarring as much as possible. On parts of the body under greater stress, including the hands, arms, and legs, sutures can stay in up to 2 weeks. After you leave, you may feel pain, achiness, or numbness. Most wounds are an average of 75% healed within 6 weeks. You might think that once the stitches come out, your wound is healed, but you should treat the area with caution since it can break open if re-injured. There are some types of wounds that we don't close with sutures, such as dog or cat bites, because there's a high risk of infection. And there are times when we want people to use bandages and times when we don't. Please follow your doctor's instructions to decrease your risk of infection. At home, watch for excessive redness, swelling, or a pus-like drainage, or discharge from the wound, increased pain, or even fever. These could be signs of infection, and you should come back to see us right away if these are present. All wounds are prone to scarring, but if you take good care of your wound, it will minimize the amount. Make sure to use sunscreen on the wound of SPF 30 or higher to limit scarring and the discoloration of the area. If you have specific concerns about your wound, follow up with your doctor or come back and see us.
These videos are intended to provide helpful health information to the general public. They are not intended to be a substitute for professional medical advice. You should not use this information to diagnose or treat health problems, and you should not use these videos in place of a call or visit to a medical professional. Talk with your physician about the proper treatment for your particular condition, and always follow your physician's advice. If you think you need an ambulance or are experiencing a medical emergency, please dial 911 immediately.